this video, we are going to perform range of motion exercise. First is to identify the patient and explain the procedure. Ask the client to verbalize the feeling of dizziness, shortness of breath while walking. Ensure client's privacy and perform hand washing. First is we are going to do shoulder exercise. So we are going to raise the hand of the patient, and then this is flexion, extension, flexion, extension. And if it is moving away from the body, it is called abduction. This is abduction towards adduction. Abduction, adduction. And then move the patient's arm into a 90-degree angle. So this is outward, inward, outward, inward. And then this is supination, pronation, supination, pronation. Next is we are moving forward to the wrist of the patient. So this is flexion, extension, hyperextension, flexion, extension, hyperextension. And then we are going to move the patient's wrist, and then toward the radial, the thumb. This is radial flexion, ulnar flexion, radial flexion, ulnar flexion. Then next is the thumb. This is flexion, extension, flexion, extension. And then away from the finger is abduction, towards is adduction, abduction, adduction. And then opposition to the little finger. Okay, and then do it twice. Next is the fingers. So this is abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. So now we are going to have a leg exercises, and then just expose only one leg of the patient. So we are going to flex, and then extension, flexion, extension, and then abduction, adduction, abduction, adduction. And now we are moving to the knee. So this is inward, outward, inward, outward, and then flexion, extension, flexion, extension. Then here in the ankle of the patient, we are going to perform this is the dorsal flexion, plantar flexion, dorsal flexion, plantar flexion, and then inward, outward, inward, outward. Then lastly is the toe, abduction, adduction, abduction, adduction. Then do it again. And then flexion, extension, flexion, extension. Repeat the exercises to the other side of the body. Make the client comfortable after the exercises. Perform hand washing and document pertinent observations.